My patient-doctor relationship started with Dr. Greenwald back in 2004. I was referred to her after a Trivex surgery that had failed by a local physician. They had nowhere to turn. He referred me to her, which I had said to them in the beginning, I wish I had gone to her first thing. My life drastically changed after she did a procedure on my lower leg. It was amazing. It was instant. Forever grateful for her. Our relationship continued over the years. I could call her at any time. I could come in at any time, any questions, any concerns. Very different from any other physician I've ever gone to. She's very knowledgeable, very well educated, and has my full trust.
In 2004, I remember very distinctly, I had opened up my vein center only a year before that. And when you came to me, you had had not one, but several procedures on that leg. And the amount of discomfort and disabling symptoms really stuck in my mind. You had 3 kids.
Yes, all under the age of 8. Under the age of 8 at the time. So it was very difficult. By the end of the day, the swelling was so bad, the pain. So it was not easy getting around.
You couldn't get a shoe on by the end of the day. I remember you had told me that.
Correct, yes.
Because the swelling was so bad. What I remember vividly about your leg is that you had had multiple procedures. You had had several surgeries, multiple scars.
And right before I had come to you, I had a surgery called Trivex surgery by a local surgeon that by the end of the evening, it was an in-out patient. That evening, I started to hemorrhage from the locations of the Trivex surgery, there was 9 incisions. So I had to go back to the ER, go back to the doctor 2 days later on the weekend for a check. And at that point, that's when that physician referred me to Dr. Lori Greenwald. That's when things started to change. She assessed the situation, offered my options, and we went from there. And what a difference.
Your type of vein problems is the classic person, young, healthy, huge responsibilities, going to work, taking care of kids, and you can't afford to have that amount of discomfort, that amount of swelling, that amount of disability. And back then, this was brand new. Just FDA approved a couple of years before, and we did it in the office with some numbing medicine. Since then, we've progressed, and I think the thing I remember a couple of things. I remember I spoke to you that night, the numbing, because it was a new procedure and I wanted to know how you did. The numbing medicine had worn off and you said to me, I'm better.
Downtime was nothing. By the end of the day, you had it done in the afternoon in the office. By that evening, it was already relief. There was no swelling, no downtime. I was able to just go about my daily activities. Where in the past, with the other procedures that I had done, that had failed, I was recovery time was 6-8 weeks. Crutches, very painful, and they all failed. So.
And I said, no. That's the numbing medicine. You're not going to know. It's going to take a while. She says, no, I know. I'm better. And from that day forward, you went down like 2 shoe sizes, I think.
The swelling.
The swelling, from the swelling. And you've gone almost 14 years without a recurrence.
Absolutely. Anne just had it scanned within 10 months ago, and it's still sealed. It's fine.
What type of differences did you notice from, well, you had a lot of procedures before, and then that new procedure?
I think basically when I came to your practice, the consistency of staff, the consistency of care, record keeping, and just the personal interaction. They knew you, they knew exactly, they got you right in. That's huge. The main thing that made a huge difference with your practice was the one-on-one. You were right in there. Every visit, you saw me, you talked to me, you told me exactly what was going on and exactly what you were going to do. And I asked a lot of questions. So I think that built a really nice rapport. And I see that when I come in, I see that you doing that with all your patients. And that means a lot.
Over the course of the time, many places have opened. And what have you noticed? What have your friends noticed?
An acquaintance of mine has gone to a vein center. My main concern is the amount of time in between the appointments that they were chosen to do, and the lack of recovery time for the healing. The soreness and the discomfort is a little concerning. So those were my main questions and concerns, because I never had that when I came to Dr. Greenwald. One thing I did notice with your office is that they closely monitor everything with ultrasound. The ultrasound person has been with them for as long as I've been coming. And as long as with the procedures, they have the ultrasound on at all times. Dr. Greenwald also does the ultrasounding as well. Which is very comforting because you're watching everything that's going on. My concern with some of the franchises that are coming to light are if everything is being monitored as closely. If the staff and the doctor has the education and the knowledge of just doing that one thing, such as Dr. Greenwald. And she's proven to me over and over, and several people that I know, just the expertise, which you can't second guess that.